Pnawn da, good afternoon. Thank you for joining me today as we complete the latest 3-week review of the coronavirus regulations in Wales. Today we have also published an updated coronavirus control plan, and that sets out how we will stay safe together over the summer. Now there's a great deal of detail to get through this afternoon, and I begin as usual by setting out the public health context here in Wales. I'm afraid there is no doubt at all that we are experiencing the predicted third wave of infections. Cases of coronavirus have been rising sharply since the end of May, driven by the new Delta variant. This is now the dominant strain in Wales, in the rest of the United Kingdom and in many parts of Europe. Although cases are high, at 145 cases per 100,000 people in Wales, at the moment, the good news is that we are not seeing this translate into a large number of people becoming seriously ill or needing hospital treatment. And thankfully, the number of people dying remains very low. Nevertheless, our thoughts continue to be with all of those who have lost a loved one to this terrible virus. Now, as the Chief Medical Officer said here on Monday, we are increasingly confident that our high vaccination rates have weakened the link between infections, serious illness and hospitalisation. Weakened, but not broken. There is still a risk that we could see considerable harms in this third wave. Direct harms from the virus itself, including from long COVID, and wider harms as larger numbers of people are off work self-isolating and from the impact of restrictions. Now, 4 weeks ago in Wales, we paused changes to the restrictions to focus on vaccinating as many people as possible. Over this period, we have sent more than 500,000 doses of the vaccine into the NHS. And by the start of this week, we had vaccinated almost 400,000 more people with either a first or second dose, the majority of those being second doses of the vaccine. Our vaccination programme has done the most fantastic job, and we have very good take-up rates, helping to change the relationship with the virus. But we need more people to be vaccinated. 1 in 4 adults under 40 have yet to have any jab at all, and yet it's this age group where we are seeing the higher levels of infection at the moment. Our ability to go on releasing restrictions will depend in part on having high rates of vaccination in all age groups. So please, come forward. Take the vaccine here in Wales. It's never too late to be vaccinated. Now, if that is the general public health context, I turn now to the 3-week review. We have looked carefully at all the evidence and the data, and we have concluded that we have headroom to complete the alert level 1 changes in indoor places, which we paused 4 weeks ago. And the slide you will now see shows the changes we are making. From this coming Saturday, the 17th of July, up to 6 people will be able to meet indoors, in private homes and in holiday accommodation. Organised indoor events for up to 1,000 people seated or 200 people standing can take place, provided a risk assessment has been completed and implemented. Ice rinks will be able to reopen. The regulations will also change to allow up to 30 children from organisations such as the Gyda'r, the Brownies and Scouts to attend residential activity centres over the summer holidays. And we conclude that we can go one step further outdoors. we will remove the limits on the number of people who can gather outdoors, and there will be more flexibility around social distancing, both from the 17th of July. Now, we're doing all of this because the scientific evidence continues to tell us, as it has throughout the pandemic, that the risk of transmission outdoors is much lower than indoors. And at the same time, we want us all to be able to take advantage of the summer months. This will be Wales's first step into the new alert level 0. We'll move into that alert level, as we always have, in a careful, phased way. Outdoors first on the 17th of July, and if the public health position allows, we will complete the move on the 7th of August. Now, waiting until the 7th of August will allow us to continue to increase vaccination coverage, and we expect that by the 7th of August, 85% of all adults in Wales will have had both doses of the vaccine. And we could do better than that. There's enough vaccine in the system. There are enough venues open, including walk-up venues, to allow us to get beyond that 85% threshold. Now, the new alert level 0 has been designed to maximise our personal freedoms. There will be no legal limit on the number of people who can meet, including in private homes, public places, or at events. And all businesses and premises, including nightclubs, will be open. But I want to be very clear with everybody about this. This is not a free-for-all. In Wales, we will not abandon those simple but effective and successful measures that have helped to keep us all safe. There will continue to be some important protections, especially important for those who are clinically vulnerable and who are perhaps the most anxious about an easing of restrictions. We will continue, therefore, to ensure employers protect both workers and customers. Coronavirus risk assessments will continue to be a legal requirement here in Wales for all businesses, employers and events organisers, and reasonable measures will need to be put in place based on the risks identified. Even at alert level 0, we expect people to continue to work from home wherever that is possible. And face coverings will continue to be a legal requirement here in Wales, on public transport, in health and care settings, and in indoor public places other than education and hospitality. And our aim will be gradually to ease these restrictions as the public health risk decreases. Now, we will make 2 further changes to the rules, both in relation to the need to self-isolate if you have been fully vaccinated. I deeply regret the UK government's decision to remove the requirement for adults who have been fully vaccinated to self-isolate when returning from countries on the amber list. The risk of re-importing the virus or a new variant of the virus is real, but we have no practical alternative but to follow. It would be untenable, as the Chief Medical Officer says, for Wales to adopt a different border health policy. Nevertheless, everyone returning from an amber list country to Wales must take a PCR test on day 2. And we will be clear in Wales that people who have visited an amber list country should not visit a hospital or a care home until the normal self-isolation period would have been expended. Under 18s will also be exempt from the need to self-isolate on return from an amber list country. All of these changes will come into effect from the 19th of July. But again, I want to be clear that the advice of the Welsh Government has not changed. We continue to advise against all but essential travel abroad. This is the year to holiday at home. Now, finally, next month we will also remove the requirement for people who are fully vaccinated to self-isolate if they are a close contact of someone who has tested positive in a domestic setting. There will be additional safeguards in place for people who work in health and social care settings. And of course, if you have symptoms of coronavirus or if you test positive, you will need to self-isolate whether you are fully vaccinated or not. These changes will come into force during the next 3-week review cycle, which begins on the 7th of August. Now, this is an important set of changes. Together, they will make life a lot more like it was before the pandemic began. But as we do so, we have to go on keeping coronavirus under control. The pandemic is not over, and we all need to work together to protect ourselves and each other from coronavirus. The best way to do that is to make sure we've all been vaccinated. But the small things we've been doing together remain even more important. Washing our hands, meeting outdoors, minimising social contact, keeping our distance, keeping indoor spaces well ventilated, wearing a face covering in indoor public places, on public transport, and in health and social care settings, and working from home. These are the actions we can take together. Together, we can keep Wales safe. Diolch o galon I chi gyd, and please enjoy the summer ahead of us. I'll now take questions from journalists, and as usual, all the answers will be broadcast on the Welsh Government's own social media channels. And first of all, this afternoon, over to Catrin Harve-Jones at BBC Wales.
Diolch Prif Weinidog, a os allwn ni gael yr atebion yn Gymraeg hefyd os gwelwch yn dda. So firstly, you said previously that you don't agree with mandating COVID passports or certificates, but you've also previously said there are prizes to be won from them. Your control plan today notes that the UK government is encouraging their use in nightclubs and other premises. Would you also encourage their use in nightclubs and other premises?
Well, first of all, to be clear, that vaccination certificates will be available to anyone in Wales who needs one. So if you need a certificate for purposes of foreign travel, for example, or to visit any venues, they will be available in Wales. There will be no mandation of such certificates here in Wales. They will never be a requirement for people to demonstrate that they have been vaccinated in order, for example, to use an essential public service. Where individual businesses make the decision to require certification, then that certification will be available in Wales. I don't think it's for the government to encourage it. It is for those individual businesses to make that decision. And if they do decide to require a certificate, then Welsh citizens will be able to receive such a certificate here in Wales. So just i bod yn clir, bydd dysgrif ar gael yma yng Nghymru trwy y system swyddogol I unrhyw un sy'n eisiau cael un. A ni'n gwybod mae nifer o bobl, mae'n angenreidiol iddyn nhw cael rhywbeth fel yna I teithio tramor enghraifft. Lan yw e i'r bobl sy'n redeg bob maes. Os mae nhw'n eisiau wneud I cael rhyw fath o certificate yn angenreidiol, bydd certificate ar gael yma yng Nghymru. Nid lan i'r Llywodraeth dwi'n meddwl I roi cyngor i'r bobl sy'n redig gweithlu fel na, lan iddyn nhw yw e.
Okay, diolch. Ac yn ail wedyn, yn Gymraeg hefyd, os gwelwch yn dda. There has been a social distancing requirement in law for some time now. Can we just get a bit of clarity on what actually happens at level 0? Will it still be in legislation, or will it be up to businesses to decide if they need to continue doing it?
What will be in legislation will be a requirement for a workplace to carry out a risk assessment and to take all reasonable measures to ensure that their workforce and their customers are kept safe from coronavirus. Up until now, social distancing has been a slightly separate standalone requirement. From now on, it will be one of the measures which a business can take. So it will be included in the risk assessment, it will be included in the measures which a business can take, but it will be there alongside all the other measures rather than a separate measure in its own right. So it will not have disappeared from the repertoire of measures here in Wales, but it will be navigated alongside all the other things which a business can choose to do. So ar hyn o bryd, mae wedi bod yn angenreidiol i'r bobl sy'n redig y gweithlu i cadw pellter cymdeithasol ar wahân i popeth arall maen nhw'n wneud. Yn y dyfodol, bydd yn angenreidiol i bobl asesu'r y risg ac i cymryd y camau sy'n helpu i cadw staff a bobl sy'n defnyddio'r y gwasanaethau neu beth bynnag sy'n mynd ymlaen yn y gweithlu i cadw bobl yn ddiogel. Bydd cadw pellter cymdeithasol un o'r y restr o pethau mae bobl yn gallu defnyddio i wneud hynny, ond nid ar wahân i popeth eraill, ond ran o'r pecyn o pethau, mae pobl, bydd rhaid i pobl dod dy gilydd i cadw y lle a bobl yn y lle yn ddiogel. Catrin, diolch yn fawr. Over to Adrian Masters at ITV Wales.
Thank you, First Minister. Can I begin by picking up on the points you were just making? Can you clarify that in the shorter term, so in other words, from Saturday, when it comes to indoor events of 1,000 people seated and 200 standing, that those risk assessments that you talked about then, does that mean that there wouldn't have to be social distancing on the basis that you just mentioned at those events? So if you could answer that. And also then, on the idea of the risk assessments more generally, particularly after August the 7th, aren't you, A, putting a lot of pressure on the venues to carry out those risk assessments and check that things are safe, and B, relying an awful lot on those risk assessments being done and followed? Will you check on them? Will you enforce them?
Adrian, thank you very much. Let me take that general point first. So in the new regime, there will be a series of obligations on workplaces to make sure that their workers and their users are kept safe. And the risk assessment is critical to that. There is an existing obligation on workplaces to carry out a risk assessment, both in coronavirus regulations, but also through the regulations that underpin the Health and Safety Executive. So there will be 4 things that will be required in Wales. First of all, there will be an obligation to carry out a risk assessment. Secondly, there will be an obligation to involve the workers in that workplace in the production of the risk assessment. Thirdly, there will be an obligation to make available the risk assessment to people who wish to see it. And fourthly and finally, there will be an obligation to implement the actions which the risk assessment sets out. So you are right that we are placing a greater reliance on risk assessment in the future, but we are therefore strengthening what is required in that field by, as I say, making sure that workers have a right to be involved, that the document can be produced to those who want to see it, and this is a new obligation, that having carried out the risk assessment and identify the things that need to be done, you'll then be under an obligation to make sure that those things are actually put into practice. And that's why we feel that we can rely on this new way of making sure that workers and users are kept safe. And to go to your first question, social distancing now becomes one of the things that can be deployed as part of that repertoire of actions that keep the workplace safe. Not a separate standalone obligation, but weighed up with all the other things. And I'm quite sure that it will continue to be part of that repertoire, not always at a 2-metre social distance, because that isn't always feasible. But where it's not feasible, you would expect other measures to be deployed to make up for the fact that a 2-metre social distancing isn't going to be observed.
Thank you. That's very clear. And secondly, then, can you, you've already started to alluding this, but can you explain how and when you will make the decision about August the 7th? In other words, could it be delayed if the situation were to deteriorate, and when would you make that decision? And will the restrictions that remain in place after August the 7th that you've spoken about, will they be, is the intention to completely lift them in the next round, i.e. the 19th to the 21st of August? I realise that I'm going several review stages ahead, but I just wonder what your thinking is about that.
So thank you. What we will do will be to review the further measures that we have outlined for the 7th of August. And to be clear, that is our intention. That is what we want to see happen on the 7th of August, a move to level 0. But that is 3 weeks away, and in coronavirus terms, that is a long way off, and a great deal can happen. We will continue to sustain the 3-week decision-making cycle that we've had in Wales now for a very long time, to give predictability for people in Wales and to allow us always to review the impact of the steps we are taking in this cycle. So, there's a significant number of easements now going to happen on Saturday of this week. We need to make sure that they're not having any unintended consequences. And we particularly need to do that at a time when the prevalence of coronavirus in the community continues to rise. So we will measure it in all the normal ways. We will look at the number of people who are falling ill. We will look at the positivity rate. We will look at the number of people who require hospital treatment. We will look at the length of stay. People in hospital, we look to see how many more people we persuade to come forward for vaccination. And if everything remains by the 7th of August in the sort of position we are in today, then we will be able to move ahead. If everything deteriorated, if new things were to happen, look how fast the Delta variant has, come into Wales and spread everywhere in Wales. If things were going in the wrong direction, that sort of way, well, of course, we would, probably pause and not introduce it as early as we would hope. If things continue to be on a positive trajectory beyond the 7th of August and further into the year, then our aim, of course, is always to lift restrictions that have to be imposed in people's lives. But we have no plan to say that in a further 3 weeks, all the other measures we take that help to keep us safe would be lifted. It's a long way off, and we'll keep it under review, but it's not part of our plan to say that 6 weeks from now, everything that we ask people to do will be over. Adrian, thank you very much. Over to Dan Bevan at LBC.
Thank you very much, First Minister. Good afternoon to you. If I could turn the attention to travel, and particularly to travelling to amber list countries. The PCR tests in Wales are far more expensive here than they are elsewhere in the UK. But of course, the fact is, it's not illegal to go on holiday to these countries. I know you've previously said this is the year to holiday in the UK, but people are still free to do that if that's what they want to do. And it isn't just holidaymakers. Of course, people who call Wales home but have family abroad, they might not have seen them in a very long time. So why are they being unfairly treated with these cost barriers, and will you be removing them?
Well, let me repeat, as you said, Dan, that our advice is this is the year not to travel abroad, and travelling abroad to amber list countries brings real risks with it. Risks of re-importing the virus into Wales, risks of importing new variants of the disease that we see developing in many other parts of the globe. So it's certainly not risk-free, and that is why we still need to have some preventative measures when people return. We require people to take an NHS PCR test, and there's very good reason for that. First of all, we can be confident of the quality of the tests that people are taking. This is a proper NHS test that you take in Wales. And secondly, we have a guarantee that the results of that test are conveyed immediately into the patient's record, so that if somebody falls ill or if a PCR test turns out to be positive, then that information is immediately available to the medical team that will then attend to that person's needs. So I understand the point that it is a bit more expensive than some other tests that you can buy, but there are good reasons for why we do things in Wales. And at this point, at least, we have no plans to alter our current regime.
Thank you. And you've earmarked, of course, August the 7th as the next easing date, but I'm curious as to find out why then, because in the last 3 weeks, all we've seen is an exponential rise in cases. Of course, deaths and hospitalizations have remained relatively low. But what are you expecting to see in the data, or what do you expect to change in the next 3 weeks that makes unlocking on the 7th of August more safe than to do it on Saturday or even Monday?
Well, the reason for the 7th of August is because of the 3-week cycle that we have long had in Wales. We are, as ever, doing the least risky things first. And the least risky things at alert level 0 are the things that happen outdoors. So mixing outdoors, we know, is less risky than indoors. But in the context we're in, where numbers are rising, where there is evidence from other parts of the United Kingdom that hospitalisation rates are going up, where we ourselves have 10 people in intensive care in Wales today. And, we were down at one point to nobody at all in intensive care suffering from coronavirus. Those numbers have crept up as the numbers in the community have risen. So when you have that wider context, then you don't want to do the most risky things immediately. You start with the less risky things, you monitor them carefully, you look to see the impact that they are having. If, as we hope, because they are the least risky things, they don't add materially to the risks that people are running, then in 3 weeks' time we will be in a position to move ahead. But that step-by-step way of doing things, do something, review it, take it into account, make a next decision on a 3-week cycle basis. I think it has stood us in good stead in Wales. It has helped to keep us safe, and we continue to operate in that way. Dan, thank you. Draw I Lydia Griffiths, S4C.
Diolch, Prif Weinidog. Just pigo fyny ar y pwynt dwytha na fanna rwan. O ystyried bod y gyfraddau brechu yn uwch yng Nghymru o'i gymharu â Lloegr a'r Alban, pam eich bod chi'n penderfynu camau arafach yn hytrach na bod ar y blaen?
Wel, diolch yn fawr, Lydia. Beth chi'n dweud yw yn wir. Mae lefel o bobl sydd wedi cymryd y brechlyn yma yn Cymru yn uwch na yn Lloegr a'r Alban neu yn y Gogledd Iwerddon. A mae hwnna yn helpu ni. Mae hwnna yn rhoi ni mewn sefyllfa ble ni yn gallu bwrw mlaen gyda popeth i'n mynd i wneud ar dydd Sadwrn ac i cynllunio ymlaen at y 7th o Awst. Ond mae pethau eraill yn y cyd-destun sydd ddim cweit yn yr un lle. Ni'n gwybod mae y nifer o bobl sy'n cwmpo'n dost yn cynyddu bob dydd. Ni'n gallu weld, nid yng Nghymru, ond yn yr Alban ac yn Loegr, y nifer o bobl sy'n cwmpo'r môr dos, mae rhaid iddyn nhw mynd mewn i'r ysbyty yn tyfu hefyd. A dyna pam ni'n neud e yn y ffordd ni'n neud e. Cam wrth gam, trial i wneud pethau yn ofalus, trial i warchod bobl yma yng Nghymru, A mae hwnna wedi bod y ffordd ni wedi wneud e, ac yn fy marn i, mae wedi helpu ni i dod at y sefyllfa ble mae nifer o bethau yn Gymru yn well nag unrhyw wlad eraill yn y Deyrnas Unedig. Lydia was asking me why, when our vaccination rates are the highest in the United Kingdom, we are still taking a cautious approach to the lifting of restrictions. Couldn't we go further, Lydia asked. And I simply confirmed what she said. Our vaccination rates are the best in the United Kingdom. Over 73% of people in Wales have had 2 doses of the vaccine. That's 66% in England and Scotland, and 65% in Northern Ireland. That's a significant advantage that we have. But nevertheless, the other things in the context, the rising numbers of cases in the community, over 1,000 new cases yesterday, the evidence from elsewhere that is beginning to turn into greater pressure on hospital services, the fact that we have 10 people in intensive care in Wales, all that is what gives us pause for thought and why continues to put us in a position where moving carefully, step by step, remains the best way to deal with a public health crisis in Wales.
Diolch i chi. Ar y llaw arall, chi'n gwybod, mae'r gyfraddau o bobl ifanc sydd yn cael ei brechu yng Nghymru yn isel 1 ym mhob 4 heb gymryd y brechlyn. Chwyd, o ystyried hynny, ydy o'n benderfyniad cyfrifol i ganiatáu 200 o bobl ifanc fynychu mewn gig dan do, a pam bod chi wedi methu a sicrhau bod mwy o bobl ifanc yn cymryd y brechlyn?
Wel, mae ffigurau da fi fan hyn am heddi. Mae 75% o pobl sy'n 30 i 39 oed wedi cymryd y dos gyntaf, a mae 73.3 o bobl sy'n 19 i 29 oed wedi cymryd y brechlyn. So mae'r ffigurau na, mae nhw'n dda. Ni'n eisiau gwneud fwy o'r cwrs, ond mae nifer yn mynd lan bob dydd. Mae'r system yn trial i roi popeth yn ei le i wneud yn haws i bobl ifanc i troi lan. Pop-up clinics, drop-in clinics ac yn y blaen. Ac ni'n trial i perswadio bobl ifanc hefyd trwy lot o bethau ni'n neud. Mae'n helpu iddyn nhw, ond pan maen nhw'n cymryd y brechlyn, mae'n helpu bobl eraill hefyd. A dyna beth ni'n mynd i'n bwrw mlaen i wneud dros y 2 wythnos nesaf, i wneud fwy, i wneud yn cyfleus i bobl ifanc, i dod ymlaen am y brechlyn, and hefyd i wneud fwy i trial i perswadio nhw. A nid just gwaith y llywodraeth yw hynny. Mae gwaith ni gyd yn gallu wneud pan ni'n cwrdd â bobl bob dydd, just i trial i roi y neges iddyn nhw. Mae'n haws i cael y brechlyn yma yng Nghymru, a chi'n helpu ni i gyd pan chi'n dod ymlaen i cael e. Lydia asking me about the number of young people in Wales who are yet to be vaccinated and why the numbers are lower in that age range. I quoted the figures from today. People in their 30s, 75.4% have already had a first dose. People aged 18 to 29, 73.3 people have had a first dose. Those are good figures. Not as good as we would like them to be, however. The number is going up every day, and we need more people to come forward. And the system is doing everything it can, making it as convenient as possible for young people, pop-up clinics, drop-in clinics, open access services, and we will be having a major push through advertising and other measures to try and make sure that young people get the message. Vaccination is easily available to you in Wales. It protects you, and you will be playing your part in protecting other people who matter to you. And that is not a message which it is simply the responsibility of government to convey. It's a message that all of us can help to convey in the daily contacts that we have with other people, and in the chances that we have to pass that message to those younger people in our society. Lydia, diolch yn fawr am y cwestiynau. Over to Kate Powling at Good Morning Britain.
Sorry, just unmuting. You say you've made quite strong comments about Westminster, say you deeply regret the decision about stopping quarantine from amber countries and that it's untenable for Wales to be different, that you have to be in sync. Do you feel kind of bounced into it by Westminster?
Well, we're bound into it, even if we're not bounced into it. 3/4 of people who travel abroad from Wales do so from airports outside Wales. So that's what I meant when it was untenable. If we were to try and have a rule in Wales that you couldn't travel abroad to amber list countries, people would simply go to airports elsewhere and do it anyway. So there is no point. I've always, sort of described it as a sort of King Canute approach to government when you issue an instruction that you are sure will not be obeyed. So we're not going to do that. I do regret it, though. I do think that going abroad on holiday this year, it's not an essential thing. It's a matter of choice, and it's a choice that puts other people at risk. Here in Wales, our problems in the autumn of last year undoubtedly began when people returned to Wales from other countries in Europe, bringing the virus with them. And we saw a rapid rise towards the end of September as a result of all of that. And this year, as well as the existing viruses, the Alpha variant, the Delta variant, there is the risk of new variants occurring elsewhere. And new variants where the vaccine may not be as effective against them as the vaccine, thank goodness, is against the Alpha and the Delta variants. All of those seem to me to be risks that we could have mitigated by doing more to persuade people this year, 1 year, to stay at home. The weather in Wales is absolutely beautiful today, and Wales is a beautiful country. I think spending 1 year holidaying at home is not a great hardship for most people and will be making a contribution to keeping us all safe.
Can I just follow up and ask, do you think that Westminster not following that is reckless?
Well, I don't want to say that. I don't say reckless because they've made a calculation, and all these calculations are risk based, and you make your own assessment of where on that risk spectrum you think we should be. We would have calculated it differently. Of all the things that we have dealt with together, this is probably the area where we have had the biggest disagreements with the UK government. We would have put everybody on a red list and only allowed travel by exception. We would have put India on the red list far earlier than the UK government did. It's been a series of decisions where we would have taken a more precautionary approach. I'm not going to say people are being reckless, because although they've taken a different view, they would have weighed it up and come to their conclusions. We would have done it differently.
Thank you.
Kate, thank you very much. Over to Howard Griffith at BBC News.
Prynhawn, first of all, on alert level 0, masks, it sounds like will be with us for some time. Realistically, do you think people in Wales will be wearing masks in 6 months, in 12 months' time, given that the winter could bring yet more pressure?
I don't think a sensible person could say those things would be impossible. I hope not. I hope we won't be wearing masks in the summer of next year, of course. And as soon as the public health position is safe enough for us to stop requiring people to wear them, then that is what we will do. Our judgment is that at the moment, with rising numbers and with the risks that brings, it is better to make that contribution to your own safety and to other people's safety that comes by wearing masks in crowded and unavoidable places. Could it continue into the rest of this year? Well, a great deal will depend on what the autumn brings, and whether, as we go into the less good weather, we see a resurgence of coronavirus as we did last year. The vaccine will make a big difference to that, and other things might help as well, but it will be a constant weighing up of the risks. We will do it every 3 weeks, and as soon as we believe that it is safe, we will continue to roll back on the places where we think that compulsory mask wearing is a necessary contribution that we can all make to keeping one another safe.
You've not ruled out needing to keep the current restrictions in place in 3 weeks if the data doesn't go the right way. If there's another variant, would you rule out another lockdown longer term, maybe in the winter, if the situation demands it?
Well, it would depend, however, I think crucially, on whether a new variant escapes the effectiveness of the vaccine. So fortunately, the Delta variant, 2 doses of the vaccine, turns out to be very effective against it as it was against the Alpha variant. So new variants might arise, and the vaccine programme, and we'll have a booster vaccine programme here in Wales in the autumn, vaccination might continue to erode the relationship between falling ill and hospitalisation, in which case I would very much hope that we would not need to go back to the sort of blunt measures that we've had to deploy earlier this year and in the spring of last year. But if a new variant were to emerge where the vaccine wasn't effective against it, and we were faced with hundreds and thousands of people falling ill and needing hospital treatment to deal with that, then we would have to be willing to look at measures which would once again help us to defend one another against a vaccine, against a virus, where the vaccine is no longer the protection that it is today. Hywel, diolch yn fawr. Over to Will Hayward at Wales Online.
Thanks very much, First Minister. I'd like to continue with what you were just talking about then, please. What would you say is the likelihood of these restrictions coming back again within the next 9 months? What would be the first restriction you look to impose if you needed to? You've said in the past that pubs, schools and gyms won't have to be closed again to manage the pandemic. Do you stand by this? And can I just get a clarification? We've had a lot of messages from people asking about masks on August the 7th. Will they still be mandatory in places of worship?
On places of worship, we continue to be in discussion with the Faith Forum here in Wales. Our last discussion with them, on the whole, I think Faith Forum members felt it would be sensible to retain the use of masks in places of worship, but it was not a unanimous view. So we will continue to have that conversation, and we'll be able to make a final decision on that when we're better informed by the views of people who have to make these things happen in the place of worship setting itself. My own assessment, Will, is that provided a new variant that escapes the vaccine doesn't emerge, it's not likely that we will have to head back into the sort of level of restrictions that we saw over the Christmas and New Year period, because the vaccine is having that very profound effect of eroding, not eliminating, but eroding the relationship between falling ill and hospitalisation. And provided that is sustained, then we will not need to head back into the level of restrictions that we saw before. Of course, if things were to get worse, if you were to have a variant where the vaccine was not ineffective, but not as effective as the one we have now, then there are things that we could move back to, but not back to the level of restrictions that we all had to face when things were at their most difficult.
That's good to hear. So can I ask your advice to people who are shielding or who were shielding? Even with a jab, they are more at risk, and many people in that category are not able to be jabbed for health reasons. Are we essentially saying that society reopening outweighs the risks to their lives, and people will have a chance to go to festivals and nightclubs in the summer after August the 7th? Can you tell us if you'd feel personally safe doing this on August the 7th? Will you be going to a festival?
No current plans to be doing any of those things. But would I feel safe? Yes, I would feel safe, and I wouldn't be suggesting it to others if I didn't think it were safe for them. As to people who are clinically vulnerable, people who were previously on the shielded list, we are discussing whether the Chief Medical Officer might write out to people again, giving them fresh and updated advice in the new context. The Cabinet discussion earlier today very much focused on the experience of people in those circumstances. And one of the reasons, not the only reason, but one of the reasons why we will continue to make mask wearing mandatory is that we don't want people who are clinically vulnerable to feel that they are no longer safe if they go to do as basic a thing like pick up a prescription or go to do their shopping. And because we want to go on having a society here in Wales where we do think carefully about the most vulnerable and the obligation on each one of us to play our part in helping to keep them safe, that was part of the reason why we came to the decision that we did. So the needs of the clinically vulnerable have been very much in the forefront of the discussions that we've had inside the Welsh Government, and we will go on making sure that they have the best advice, that they have help when they need it, and that we can do what we can to give them the confidence of knowing that they live in a country where people are still prepared to do things that help to keep them safe.
Thank you, First Minister.
Well, thank you very much, Andy Davis at Channel 4.
Thank you, First Minister. There's no sign at the moment that you're planning to remove the legal requirement to wear masks in certain settings in Wales. Yet we know that over the summer there's going to be a huge number of people coming from England into Wales for their holidays, where that legal requirement won't be in place from where they've come from in England. What would your message be to them?
Oh, well, my message to them is that when they are in Wales, they are bound by the law in Wales, and the law will require them to go on wearing masks in the contexts that I've set out. So that's what people who come to Wales will be required to do, and we can be as clear as we can be with them about that.
And just looking ahead now to September, when schools return, do you envisage any restrictions being in place in educational settings? And what are you beginning to think of in terms of what would happen if a pupil tested positive?
Well, I do envisage some restrictions still being in place. We have said in the letter that my colleague Jeremy Miles sent to head teachers in Wales last Friday that we wouldn't expect face coverings to be used routinely in the classroom, but that does not mean that it would not be expected routinely, for example, in corridors or places where there are a lot of students having to pass each other in a busy part of the school. And school buildings in Wales vary enormously, don't they? We have, thankfully, a large number of 21st century schools with lots of space and wide corridors and ways in which the school can be organised, which minimises risks. And we have some schools that were built in the 19th century, where those possibilities are much more limited and where mask wearing becomes a more necessary part of the repertoire. So yes, I think there still will be some constraints in the school setting. As far as the classroom is concerned, we are going to move away from the current regime where you have a bubble which can involve quite a lot of children, and where if one child tests positive, then the whole class, or sometimes indeed the whole school year, has been asked to self-isolate. Instead of that, we will rely on the TTP system to advise head teachers about a proportionate regime in which the risks that are greatest are attended to, but that the risks of children missing education are mitigated as well. So we would certainly expect to see far fewer children being asked to self-isolate if somebody in their class or in their year were to fall ill with the virus. And we will be working that through with our teacher unions and local education authority colleagues over the coming weeks. Andy, thank you very much. Draw I Gwyn Loader at Newyddion.
Diolch yn fawr, Prif Weinidog, pnawn da. Drydiau yn ôl, roedd Frank Atherton yn sefyll ble i chi yn dweud bod ni'n wynebu gaeaf hynod galed oherwydd y feirws. Mae weld bod pethau wedi newid, felly pam i chi'n credu bod y llacio yma yn rhywbeth y gallwch chi wneud nawr o gofio'r hyn wedodd Frank Atherton ar ddydd Llun?
Wel, mae nifer y pethau wedi newid dros y misoedd. Y brechlyn yw yr un gyntaf ac yr un pwysica, achos mae hwnna wedi newid y perthynas rhwng cwmpon dost ac bydd yn môr dost, mae rhaid i bobl cael triniaeth yn yr ysbytau. Mae'n mwy na'r brechlyn, a hefyd mae'r ONS bron bob wythnos yn cyhoeddi ffigurau sy'n dangos a lefel yn bobl am bob gwlad yn y Deyrnas Unedig gyda rhyw fath o protection rhag ofn maen nhw'n cwmpon dost, a mae'r lefel yn Cymru yw yr un is yn y Deyrnas Unedig. Mae hwnna'n help hefyd. Ac yn y trydydd lle, y system profi ac olwrain sy'n da ni, mae hwnna'n help hefyd. Pan ni'n tynnu popeth dy gilydd, a pan ni'n defnyddio y cyfleon mae'r haf yn rhoi i ni, nawr yw'r amser ni'n wedi penderfynu, a mae'r Prif Swyddog Meddygol wedi cyhoeddi y Cyngor sy'n cefnogi beth ni wedi cyhoeddi hefyd. Nawr yw y foment pan allwn ni symud ymlaen. So Gwyn is asking me why, when the Chief Medical Officer was setting out the risks that we continue to face and the prospect of what could still be a difficult winter, what are the factors that have allowed us to move ahead with lifting some of the restrictions in the way that we have? I said that there were three key factors. There is vaccination, which we didn't have last winter and which has modified the relationship between falling ill and needing hospital treatment. There is the level of immunity in the whole Welsh population. The ONS publish, I think weekly, figures that give you the level of immunity in the populations in England, Scotland, Northern Ireland and Wales. This week says that the 92% of the population in Wales have immunity against the virus, either through vaccination or because they've had coronavirus or because they've acquired a natural immunity in some other way. That's the highest figure anywhere in the UK, and that is on our side as well. Then the success of our TTP system, the fact that we are able to rely on that in Wales, that's another reason. And then finally, I pointed to the fact that, we have to take some advantage of the summer months. If we are facing a more difficult winter, then all the more reason to allow people to do more and to use more of the opportunity that the summer offers when it's safe to do so. And of course, the Chief Medical Officer, as ever, has published his own assessment of the measures we are taking today and has endorsed the package of easing of restrictions that I've outlined.
Wedi dweud hynny I gyd, fe fydd llacio yn anorfod yn golygu bod yna fwy o risg I bobl gael I heintio. Ydych chi wedi gwneud unrhyw waith modelu am faint o bobl yn rhagor sy'n debygol o farw o ganlyniad i'r llacio ar mesurau chi'n ei cymryd?
Ni'n cymryd modelu. Mae'r Prif Ysgol Abertawe yn creu I ni, a ni wedi dibynnu arnyn nhw nawr am mwy na lai y flwyddyn diwetha I gyd. So mae nhw'n neud y gwaith o modelu pethau, a be mae nhw'n ddweud I ni ar y foment yw, mae'r model, mae'n dibynnu ar nifer o pethau, ond dau bethau'n penodol. Faint o'r gwarchod mae'r brechlyn yn rhoi I ni. Ac os mae'n brechlyn yn rhoi warchod I ni ar ben top y restr, bydd hwnna yn mynd I cadw y nifer o bobl sy'n cwmpon dost ac yn marw I lawr. Os mae brechlyn yn troi mas I bod nid cweit mor effeithiol, bydd y nifer o bobl sy'n cwmpon dost ac yn marw yn mynd I cynyddu. Ac yr ail peth sy'n neud wahaniaeth mawr yw sut ni I gyd yn bihafio. os ni'n dal ati I defnyddio mwgawdau, cadw pellter cymdeithasol, parchu bobl eraill, golchi dwylo, popeth dwi wedi esbonio unwaith eto brynhawn yma, a pethau syml a pethau bach, mae hwnna yn helpu I cadw y nifer o bobl sy'n cwmpo'n dost a marw yn lawr. Os mae bobl yn meddwl, wel, mae coronavirus wedi diflannu, it's all over now, a mae pobl yn bihafio fel na, wel, mae hwnna yn mynd I tyfu y nifer o bobl sy'n cwmpo'n dost hefyd. So, mae'r model...
Chi'n gallu rhoi rhifau ar hynny, Prif Weinidog?
Mae'r rhifau dim dan ni, ond ni yn cyhoeddi y model bob tro. So, mae'r ffigurau ar gael yna yn y dogfen wythnosol, mae'r TAC yn cyhoeddi. A mae'n dangos mae wahaniaeth eitha fawr rhwng yr un ffordd a'r ffordd arall. Gwyn was asking whether we had carried out any modelling of the risks of people falling ill and of dying, given that any lifting of restrictions does involve more risk. And I was explaining that we continue to depend on the modelling work carried out for us by Swansea University, which we've now used for the past year, and very successful it has been. What the modellers are telling us at this moment is that the model is very sensitive to relatively small changes in a couple of very important areas. If the vaccine is as successful as we hope it will be at protecting people from hospitalisation and death, then the numbers will be low. If the vaccine is not a lot less effective, then those numbers go up quite fast. And the second thing that the model is sensitive to is the way we all behave. If we continue to observe the things that have helped to keep people in Wales safe over the last 16 months, the simple things I set out earlier, the mask wearing, the respect for other people, the hand washing and so on, that will result in fewer hospitalisations and fewer deaths. If everybody acts as though coronavirus is over, that it simply disappear, and we stop using those basic ways of behaving, that will drive more people into hospital and more people will die. And that's what the model is telling us. Gwyn, diolch yn fawr. Over to Darren McCaffrey at GB News.
Thank you very much indeed, First Minister, for having me on. Really appreciate it. I suppose, first of all, my question is on the practical level of mask wearing beyond, frankly, this Monday for people travelling, like myself today. I got on the train in London. I got off at Cardiff. Do I have to wear masks when, I enter into Wales? Is it the same on buses? And if so, if that is the case, who implements this? Is that the staff on those trains and buses? Are you putting them on the front line? Have you spoken to the train companies and the unions about how practically this is going to be enforced? And don't you risk really, in many ways, actually sending those mixed messages that actually every administration across the UK has been trying to avoid over the last 18 months?
I think there's a very simple way in which mixed messages could be avoided in this instance, and that is for the UK government to bring itself into line with the governments in Wales, Scotland and Northern Ireland. The outlier here is the UK government, not anybody else. When you're leaving London, of course, Transport for London will have required you to have worn a mask while you are using its facilities. So there are parts of England that are themselves saying that they will require masks to be worn. So the easy way to avoid confusion is for the Prime Minister to move from the strong encouragement that he says he is giving. Every message he gives and the UK government gives is that you should be wearing a mask on public transport in England, to move from strong encouragement just to make it a simple requirement, so that it is simple and straightforward for everybody to understand. And then there would be no difficulty. That's the real way to solve the problem. When people, if in England it remains simply advisory and people choose not to follow the advice of the UK government, by the way, I hope they will follow that advice, then when they come into Wales, then it's the operator who will be responsible for making sure that people get the message over the tannoy, however it will be, that they're coming into Wales and the rules in Wales require people to wear face coverings. And then it'll be the same enforcement regime that we've had all along, because masks have been compulsory in Wales for many months, and that is not changing.
Thank you for that. And second of all, you've been talking recently about Boris Johnson's confrontational approach to devolution and how it is putting the United Kingdom at risk. I suppose I want to ask you if you have also had a part to play in putting the UK at risk. I look at the two measures today that differentiate Wales quite significantly from the decisions made in Westminster, and they are on face coverings and on the borders. They happen to coincide with what the Labour leadership in Westminster has been saying. In fact, you could say that an awful lot about the decisions that have been made in Wales. They've actually been the same as the Labour Party line across the country. And by doing that, many would say you're playing party politics here, and that in itself, in essence, risks undermining the union, because that politics, you're making decisions as a Labour politician, not necessarily just as First Minister of Wales.
Well, I am a Labour politician and I lead a Labour government, so it doesn't seem hugely surprising to me that the things that we think are in the interests of the population in Wales are shared by Labour colleagues elsewhere. But the measures we have taken have also been shared by the SNP government in Scotland, by the DUP government and Sinn Féin in the Northern Ireland executive as well. So the decisions I make, I can assure you, Darren, they are not driven by the party politics of it. I am driven by the best advice that I can get from our Chief Medical Officer and scientists, from the SAGE committee that advises the UK government as well. All of that says to me that while we can afford to move ahead and lift some of the restrictions, despite the rising numbers of the Delta variant, we should do it in a way that is step by step and cautious, and that we can do it incrementally, that we can continue to protect people, we continue to think of those vulnerable people who are fearful of going into places where they think people may not be acting in ways that would help to keep them safe. And the people in Wales continue to be persuaded that this is the best way of keeping us all safe together. Darren, thank you very much. Over to Shane Brennan at The National.
Diolch yn fawr. What communication have you had with UK authorities to ensure that they are making it clear their rule changes apply to England only? And what practical steps are you taking to get the message across to people coming across the border into Wales?
We've had a number of opportunities to discuss all these things with UK and other UK colleagues this week. I took part myself in a meeting with Michael Gove and the First Minister of Scotland and senior figures from Northern Ireland. All three of us impressed on Mr Gove the need for the Prime Minister in his press conference to make it clear that he was making announcements for England. It's something I think the Prime Minister finds very difficult to do, and he could have done more, I believed, on Monday to be clearer with people that these were not UK decisions, they were decisions for England alone. As the pandemic has gone on, though, I think people have become far more used to the fact that there are different rules in different parts of the UK. We've lived this way now for months and months. And my colleagues who represent border constituencies tell me that while it still can be confusing for people, people are a lot more adept now at finding the rules that apply in the place where they live. We will play our part in that, of course. This press conference is part of that. The actions we will take with our public transport colleagues is another part of it. The information that our local authority and NHS colleagues provide all the time to people in Wales is part of that effort as well, and we will certainly go on making it.
Diolch. Will you welcome the return of outdoor demonstrations and protests, particularly ones on the scale of the pre-pandemic ones in favour of Welsh independence?
Well, I've always been in favour of protest myself. I've spent a lot of my life involved in them, so it would be wrong of me to not welcome it by others. I hope that when people are thinking of those sort of events, they will continue to think about their obligation to do it in a way that respects the context within which they are organising those things. And I think in Wales that has been the case, you know, not exclusively, but more often than not. Organisers of protests have done it in consultation with the police and others, and have done it in a way that continues to respect the risks that are still there in a third wave of coronavirus. So I think the right to protest is a fundamental right in a democratic society. I hope and expect that it will be exercised responsibly. Finally, then, to Nathan Shoesmith. We'll just see whether Nathan is able to get through. And there he is. And I haven't, as I should have done, said that he's here to represent the Speaker. I can see you, Nathan, but I can't hear you.
How about now?
Ah, excellent. Seeing and hearing now. Thank you.
Can you hear me now?
I can. Yeah.
Ah, there we are. Sorry about that. Good evening. You've said that COVID status certification won't be a legal requirement. Would you still encourage people to get regular lateral flow tests regardless of this? And will the provision of free tests remain when restrictions are eased?
Well, I certainly think that lateral flow tests have an important part to play, and we're doing thousands and thousands of them in Wales. We're reviewing the part that they can best play in our defences. There is some evidence that vaccination suppresses the viral load, to use that awful phrase, that we carry of coronavirus, and that it may be that lateral flow tests are not as sensitive to that as they were before vaccination began to help us all. So we are looking at the part that they can play. I do encourage people to use them where it can be an additional defence, and make sure that people don't turn up to events, for example, when they might be infectious. And at the moment, they are free to people who want to use them here in Wales.
Thank you. And it says in your updated coronavirus control plan that at alert level 0, people should continue to work from home wherever possible. Is this advice you'd hope to be lifting in the coming months, or is it something like masks, which you think will be in place while coronavirus remains a threat to public health?
While people can work equally effectively from home or from smaller remote hubs, they are genuinely making a contribution to suppressing the virus. There's no doubt about it that working from home has been one of the major contributors to keeping us all safe. But as I say, that is where people can work equally effectively from home. And not all jobs, of course, can be done in that way. So our advice is where you can work from home and work effectively from home, continuing to do so is a contribution that you can make during a third wave to keeping that third wave down. You know, as if we get to a point, when we get to a point where we're past the third wave and the virus is suppressed again, then no doubt we will recalibrate that advice. There are other good reasons for trying to have a more blended approach to the workplace, with people spending some of their working lives in an office setting, for example, and some of that working life at home. And even as we move beyond coronavirus, I think in Wales we will look to have, a more blended pattern of working than we were used to before we learnt to work in so many different and equally effective ways.
Thank you.
Nathan, thank you very much indeed, and that is it for this afternoon. Thank you all very much.